My name is Zoe Woodward. I'm one of the Obs and Gynae consultants here at QEQM in East Kent. I'm also the college tutor here at QEQM and the training programme director for the ST1 and 2s at HEKSS. There are 10 Obs and Gynae consultants within the department, and then we also have 3 gynae oncologists who just do the oncology for us. We have an associate specialist, we have 8 middle grades, of which at the moment the setup is 4 career trainees and 4 trust doctors, and we have 9 SHOs made up from 2 FY2s, 4 GP trainees and 3 Obs and Gynae trainees. Generally, it's quite a busy department. We have just over 3,000 deliveries a year. We also have a co-located midwifery-led unit where the majority of the normal deliveries take place, and the labour ward generally is for high-risk pregnancies.
I'm Rebecca, I'm the labour ward manager. This is our labour ward office. This is where you'll come for handovers. You'll meet all of the obstetric team, and also you'll have one of the Band 7 midwives who will be here for handover. On the evening handover you will also have the midwives present, do a rundown of the board, all the women that are here. You'll see the acute women, and then you'll do probably a ward round, and you may then be asked to go on to Kingsgate and to do a ward round there. This is Kingsgate ward. It's our antenatal and postnatal ward, and you may well be asked to come here to review women or to do an antenatal postnatal round, and it's also linked to our midwifery-led unit just up the corridor there.
The obstetric on-calls will predominantly be centred around labour ward, but we'll also be looking after patients on the antenatal and postnatal ward, which is physically just next door, and also in the antenatal daycare.
Welcome, I'm Sarah Spooner, antenatal and fetal medicine clinic sister. We have a maternity daycare unit and antenatal clinic in this area. I'm the team leader for this area, and I have a dedicated, experienced midwifery team. Please don't hesitate to ask any of us if you have any questions. We also have obstetric ultrasound scanning in this area, so we can liaise with the ultrasound radiology department here too.
The gynecology on-calls, there's a separate gynecology SHO to obstetric SHO during the week, Monday to Friday, 8 till 5. And the gynecology on-call generally looks after the ward which is called Birchington.
Hello, my name's Angela Harmon. I'm the gynae matron for Birchington ward, and I also work trust-wide over on Kennington ward at the William Harvey. This is Birchington ward. The ward manager is Rachel Long, and she is here for any concerns and any problems you might have. She's always here to help. And we have an early pregnancy unit and a gynae assessment unit. The gynae assessment unit is here with Lisa Morgan, who does the scanning. We would hope that you would come to visit when you're on call to find out what's going on during the day, see whether there's any patients down in A&E that need to be brought up, and she will always help you and guide you through the scanning.
But also the early pregnancy unit and the gynecology assessment unit, where the acute patients are seen as much as possible. We try to avoid our gynecology emergency patients going to A&E, but you would be expected also to go down to A&E out of hours or if needed during the daytime.
Hello, I'm Melanie. I work in the early pregnancy clinic. I'm an early pregnancy nurse practitioner. We see people in the clinic up to 16 weeks of pregnancy with pain and bleeding, any significant history like 3 miscarriages or more, ectopic pregnancies, molar pregnancies, and sometimes if they've had fetal abnormalities in previous pregnancies. Junior doctor wise, we don't really have too much to do with them unless we need prescribing, outpatient clinic prescriptions done for them to collect from pharmacy. Or sometimes an opinion on patients, or if we need some help getting bloods or if they're unwell when they attend clinic. If you have any special interest in this area, we're quite happy to have you come and sit in with the clinic if you just give us a bit of notice beforehand.
My name's Lorraine Cassavan. I'm an ST2 Obs and Gynae trainee. Definitely as a trainee you get to do a lot, so there's a lot of scope to be very involved in labour ward, and very quickly they start to see you as trying to stepping you up as a registrar, and you get asked to see get a bit more responsibility very quickly. So from that aspect it's very good, and because it is so busy you learn to be very quick and efficient.
My name is Dr. Martin Rukengwa, and I'm currently on Birchington ward. Actually, it's our gynae ward. I'm one of the ST2 Obs and Gynae trainee, and I've been working here for over a year now. And yes, it's a great place to work. We have a mix of patient, general gynae as well as gynae oncology, and it's really good.
Usually we do one on-call a week. There's the obstetric on-call, then there's the gynae on-call. So the gynae only does till 5 though. And then there's just your normal working day, which is like 8 till 5, and you could be allocated to either clinic or theatre.
The on-call day starts at 8 a.m. and we all meet on labour ward in the main office at 8 a.m. and we generally go through the obstetric patients initially first, with both the outgoing night team and the incoming day team, and with the daytime consultant as well. And then we cover any other patients on the antenatal ward, and then we also discuss any gynecology admissions or people that are still causing concern on the gynecology ward. And then we all separate and go about and do the jobs that need doing after that ward round.
And as an obstetric trainee, you would then, after the ward round of all the labour ward patients, you'd then go and consent for the elective patients for the elective caesarean sections. So there's usually 2 of those a day. So if you're an obstetric SHO on call and a trainee, you'd probably be expected to actually do the elective sections with the registrar on call. However, if you were an F2 or a GP trainee, you wouldn't be expected to do the electives if you were OBS on call. It's usually allocated to the gynae SHO. So during the day it can be quite busy because you've got to do the elective caesarean sections, the labour wards round, and then as the SHO as well, you then go to Kingsgate ward, which is our postnatal ward, and see all the postnatal patients that need a doctor's review as well. And then during the day you might also get bleeped about patients in daycare, so they'll just bleep you to review patients that might come in with a query, SHROM or PV bleeds, and you just have to go and see them in between your duties during the day. So that would be an obstetric on call. If you were allocated to the gynae on call, you still go for the handover at 8 o'clock in the morning, but then you then go to the Birchington ward, which is our gynae ward, and you start seeing the patients, do like a little ward round, and then once the consultant is free from the labour ward duties, they normally come to Birchington and then go through the ward round again with you and make plans for the patients. And throughout the day you will also get bleeped about patients in A&E or our gynae assessment unit to go and see as well. The gynae role actually is only till 5 o'clock. So from 5 p.m. the obstetric SHO normally takes the bleep from the gynae and they will then cover the rest of the shift.
The middle grade and SHO also physically meet on labour ward at about 8 p.m. at the time that they hand over, but the obstetric consultant generally leaves at about 6 p.m, so he or she will come to labour ward before they physically leave the hospital and look at any patients that need reviewing at that stage.
So night time it's just the one registrar and one SHO. There's no consultant resident here, but they can be called at home if it obviously gets very busy and they can come in. But it's usually just the 2 of you and you cover all of obstetrics and gynae for the whole night.
The operating theatres, we have some day surgery over at Canterbury. There is a hospital shuttle bus because it can be a little bit difficult to get to, but otherwise the theatre is all here in Margate. All the main theatre and our gynaecology beds are here at Margate. So you'll be allocated time for both gynaecology clinics and also theatre. We try to not give the GP trainees too much theatre because although it's important for them to see each procedure, they clearly don't need to get experience in performing it. So we do try to adjust the rota to what is required for each individual doctor. So from the gynaecology point of view, we all generally have special interests within gynecology. So some of my colleagues are urogynecologists, we have a fertility specialist, we have a couple of minimal access specialists. As I said, we have 3 gynae oncologists, and we also have some generalists and people who do colposcopy or rapid access. So within your time with us, you will be allocated different clinics, especially the GP trainees. You will always be supernumerary in a gynecology clinic, but hopefully throughout the 4 months you should be able to see at least 1 or 2 of each of the different clinics that are available, so that you can grasp what we are discussing with the patients. The clinics are all consultant-led. Some of them also have a registrar side, but the SHOs will always be supernumerary. The middle grades will have their own template, but they will always have a consultant presence in clinic as well. As far as education is concerned, we believe that a lot of the teaching and training is available all day, every day, and there's always middle grade cover and consultant cover. So a lot of training opportunities are available throughout the day.
Just for the SHOs, we have a weekly teaching. It's normally on a Tuesday lunchtime with Mr. Ishmael, who's one of our gynae oncology consultants. And basically each week an SHO will pick a topic and present the topic, and then we'll discuss it. And it's quite a good opportunity to get like a CBD signed off, or things for your portfolio that you want to get signed off.
And on Thursday lunchtimes, we generally have a lunch which is supported by a drug company, and we look at interesting obstetric cases or CTG teaching. And Friday afternoons is when the career trainees have dedicated time for their training, which can either be in-house or over at Ashford or elsewhere within KSS. All of the obs and gynae consultants are clinical supervisors, and there are a number of us that are also educational supervisors. So the career trainees will be allocated an educational supervisor during their year with us, and the GP trainees and F2s may well have one of us as their educational supervisor, but will definitely have one of us as their clinical supervisors. If there's ever any opportunities where you want to discuss how you looked after a particular patient or how a case was managed, then ask. It's often easier from a consultant's point of view if you ask then and there. We don't always have great memories, so sometimes at the moment is best, or send us a ticket soon after the event, and then we can discuss the case with you and give you any feedback as needed. For the career trainees, the higher trainees here at QEQM, we do offer a number of the ATSMs. It's all on both our website via the postgraduate link here, but also on the HEKSS website. But we do offer quite a few, so if there's anything that you are interested in, then it's always worth having a look to see whether we can accommodate it.
Hi, my name is Margot Duffy. I'm Senior Secretary in Women's Health. I'm also Mrs Shropshire's Secretary, who is Site Lead. To apply for annual leave, this is the folder which is in Mrs Shropshire's tray. You need to come in and fill in the diary and leave your annual leave forms, which Mrs Shropshire will then sign and authorise. To check to see if your annual leave has been authorised, she will actually initial beside your name, and that's when you will know if your annual leave has been authorised. We also have a tray here. It's the SHO tray, which any correspondence that comes into the hospital for you will be placed in, and you need to check that regularly.
Whether it's your first day or your 20th day, the nurses are really, really helpful. They really are helpful. If you don't know how to find your feet, where to call, who to speak to about referrals, they're really there to help you. So I have had a great time, and I'm actually hoping to come back here for my registrar years.
This hospital in particular is very friendly. Everyone is very sort of accommodating when you're new and make you feel very welcome. And I think consultants and registrars are very aware, particularly if you're a GP or an F2, that you may not have had any obs and gynae experience at all. So when you first start, everyone is there to help you, and you do pick it up very quickly. And as a GP and an F2, you wouldn't really be expected to do more beyond your level. So in that sense, I think it's a great place to learn if you're a GP or an F2.
You're very, very welcome to come here and work at QEQM. We'll try and make your time, whether it's 4 months or a year, as useful, beneficial and as enjoyable as possible. And just to reiterate, if you have any questions, any concerns, any queries, then please ask.